So I'm consider myself a general orthopedic surgeon with a subspecialty in sports traumatology. So sports traumatology is a fairly large field, and it's probably a misnomer because traumatology is traumatology, whether it's an athlete or not. But my training was more in the athletic field. So, and the focus in that sports traumatology was mostly knees and shoulders. But I also did some hand surgery. I practiced in Jackson Hole, Wyoming for 25 years before coming to San Francisco. And, we did not have subspecialists in, every area of the body. So, I felt real comfortable taking care of many different body parts and even did spine surgery at the time. But in San Francisco, I'm doing trauma, any type of long bone or small bone trauma. Not doing any spine surgery, but I'm certainly evaluating patients with spine conditions and referring them to the appropriate conservative or surgical team to deal with that. And then if there's something that's quite complex, clearly have some good resources in terms of a referral base for making the appropriate referral, if like it's a revision joint replacement or a tendon transfer that needs to be done, that kind of thing, dealing with replants, for example, of fingers and so on. Which obviously would be an emergent situation, but trying to think of other examples. I feel comfortable dealing with infections and things like that. And also comfortable with seeing adolescents with injuries, whether they're growth deformities or fractures. I've been treating children for 28 years now, so yeah.